The 2017 budget proposal for the health sector is not significantly different from those of the last 3 years, at least in content and form. The marginal increase in this year's allocation to 304 billion naira from 250 billion naira in 2016 may have been rendered worthless by inflation and high exchange rate of the dollar.
In actual terms, I think it's less because in dollar terms is actually close to $300 million less than what it was in 2016. So going by that, the dollar value of the Federal Ministry of Health budget this year is about $998 million.
If the federal government failed to meet the 15% target as agreed by the Abuja Declaration of 2001, the states did not fare better in the allocation of 4.6% of their total budget to health. Data from the Partnership for Advocacy in Child and Family Health (PACFA) shows Lagos and Rivers State as the highest spenders in the health sector, while Abia and Osun State had the lowest allocation. Operators in the industry have called on government to implement the 2014 National Health Act, which stipulates the setting aside of 1% of the consolidated revenue of the Federation to the health sector. The National Assembly says it intends to enforce the National Health Act. Records show that over 1 million children and women in the country die annually from preventable diseases, while a little below 70% of health spendings in the country are undertaken without any insurance policy. Apart from adequate allocation of funds, timely release of these funds are also crucial to policy implementation in the sector if impacts are to be felt.
Let's assume that the health budget is released in March. It will mean that it's going to work from March till December. So what about the remaining allocation for February to January? If it's going to be moved to the next budget, then we can see the impact of it generally.
Industry watchers, however, believe that not all funds applicable to the health sector are normally captured in the Nigerian budget. The Ministry of Health recently revealed that International Financing Organization, Global Fund, is investing over $1 billion in Nigeria over a 4-year period, while the World Bank has also advanced $500 million loan for health sector. All these are not captured in the national budget. This situation has led to the question of whether the health sector really needs more funding or proper implementation of the budget.
It's both. Yes, we need sufficient funding and we also need efficient utilization of allocated funds. Why do we need sufficient funding? If I have a need of, say, 1,000 naira and all I have is 200 naira, no matter how efficient, how I manage that fund, it will not solve that need.
Stakeholders have continued to bemoan the poor state of the health sector in the country, as it currently ranks 187 among 190 countries in the world. While this is going on, over $1 billion is spent by Nigerians annually on medical tourism. 80% of Indian visas granted are for medical treatment, while 60% of doctors trained in Nigeria currently practice outside the country. Lawrence Umoette'S, STV News, Abuja.